Thank you very much. Good morning, everyone. There you can. So this is the Diamedica baby CPAP. So we all know what what CPAP is. It means continuous positive airway pressure. It generates pressure using oxygen and air. That's the principle of CPAP. It must have oxygen and air blended together, deliver, and it must deliver a bubble pressure too. So the components I'll be explaining everything. But first, let's go through the machine and the parts so that if you are using it, I can tell you touch this what this is the function of this. First of all, this is the machine. This is the surge protector, and it's important that I tell you how this thing works. It works in such a way that electricity comes here. So if your electricity is bad, that means too high or too low, this guy will show either red or yellow. If you power this machine on, it will not come on. You have to wait till it turns green. So anytime you are using and it's very low or red, check maybe the light is low or it's not properly plugged before you can now say it's not working. So it will turn green. It's not very bright, but it's turned green here. Then this is the power switch where you put on the machine. One is on, zero is off. You put it on. So this is the oxygen. You can see O2 dial, the air dial. This is the missing chart. Because one of the features of CPAP is you are going to be blending oxygen and then you are not giving 100% of oxygen. So these charts will guide you on what flow rates to set to achieve a particular FiO2. This is the chart here. Then we show that thing. So this timing is telling you the duration of use of the machine. I don't really need that. This is the outlet where the gas mixture comes out from. This is where your humidifier will be. And this part should not be covered. It comes from here. We all know oxygen is cold, and cold gas or oxygen is not good for the newborn. So this helps to warm. It's not very hot. If you put your hand, you won't see it hot, but you know that it's not delivering cold oxygen to the patient. So it must not be covered. It must be left open like this. So this guy here, some people can tamper it, but it's not good to touch it. But if you touch it, don't do anything. Like a safety device inside, like a breaker inside of the machine. So there's no need touching it or putting it on. We show that part. So yes, this indicator light. We have 40. This repair. This panel means repair. 40. O2 down means oxygen is still bit low, not 100% in the tank. But green means oxygen is 100%. Now, once you put the machine on first, let's assume there's no oxygen inside now. If I put it in, can quickly turn green. But if it has not been on for some time, or let's say when you on it, you increase the flow rate so high, it will take more time to purify large volume of oxygen. So it will take more time to turn green. So if even if you have emergency and the thing is yellow, you can still use it. But if it's red, you can't use it. You have to check what's the cause. You understand? So even if it's still yellow, it means there is oxygen, but it's not 100% yet. But if it's on green, means it's 100%. Meanwhile, in case of emergency, you can still use it on yellow. It's not bad. But if it's red, don't use. So this is the bubble bottle. This is where the pressure is being generated. Okay, so you don't need oxygen to be connected to it. You don't need air compressor to be connected to it. Everything happens inside. So this is the bubble bottle. You might need no, it's not. There is always air. Even if you lock, even the inside this fridge, there is still air. Only that it might take more effort to purify, but your nipple is still spacious. Even if this place is still work. Even as much as human being can breathe inside, it will still generate it. Only that it will be emitting it out, so you might not be comfortable staying there, but it will still generate its oxygen. So this is the bubble bottle. This is where the pressure is being generated that keeps the lung open. This is calibrated from 1 centimeters of water to 9 centimeters of water. And how do you achieve this? 1 to 9 centimeters of water, or rather 10. 1 to 10 centimeters of water. So the more you turn, you set. And from our physics, the lower you go inside the water, the higher the pressure. So the more you go down, you can see as I'm turning, this is going down. And also, let me state a simple principle. There's this bubble effect. This is the guy that does the job of the CPAP. Not these are just like accessory to assist, but this is the guy that does it. So it has an advantage called the what do they call it? 90-degree bubble advantage because of this. So it makes the CPAP effective, unlike others that are straight tubes. Like the value you say that you saw, that's a straight tube. This is a 90-degree. So it means that this one is more effective than that one in terms of the bubble generation. So you set here, let's say this is 4, then you are giving 4 centimeters of water to the baby. Some say 5, depends. Everything has to be the condition of the baby that determine what values you're setting, what parameters you're setting for them. So this, sorry, lastly, it has to be filled with water to this range. So you can see the mark there. Yes, the line, the dash line. Yes. So even if it's still a little bit lower, a little bit higher, you can still use, but it must not be above this or this. If it's above, there's a tendency that water will slip back, and also your value will not be correct. You want to be, oh, I want to give 5 centimeters of water, but the water is above this. So that means you are not giving 5 centimeters. If it's lower, you are not giving 5 centimeters. You check, it does not reduce quickly, let's say in 5 hours or 6 hours before you can even reduce at all. But if it goes down or above, you don't need to off the machine. You have this guy here, just open. If you have a longer syringe, or even if it's a short one, you can see it's extended to this place. No, this has to be locked. Yes, that means when you are using the machine on a baby, you don't need to off, you don't need to switch off the machine for you to adjust it or to fill it up. I don't know if you understand what I'm saying there. You don't need to off to fill it up or to reduce it. Just open this, take water in a syringe, then pass it through here. It won't stop the procedure, it won't stop the process. Then you cover back and continue what you're doing. And it has to be filled with clean water, either distilled water or bottled water like seaway or ever. Then this is the humidifier. It has a maximum and a minimum. So you fill the water in between this. So, but this one you have to off it for you to change the water, but it does not go that easy. That's why you see the gap in between is much. Which other thing? So these are the accessories we're talking of. Talking. Yes, extra humidifier bottle. So these are the accessories. We also explain this while we are using. So these are the breathing tubes. These are the tubings. So we have inspiratory and expiratory. There's no difference between them. What differentiates them is where you connect them to, but they are all the same thing. This is water trap to trap excess water that maybe that condensed along the line or some that splash. Instead of allowing to go to the baby's nursery, it's going to trap it. Which other thing? So these are other connectors. So I'm going to explain them one after the other. Then this is a filter at the back. Yes, at the back here. Over time, especially now that we're in the dry season, so you just pull back, just pull back. Then when yes, press down and pull back, just like this. Press down, pull back. Now that we're in dry season, like I said, it traps air from the environment. That's how it works. So this is where the air will come through. So of course there will be particles like dust. So everything will be here. So what you do is you take it out, you dust a bit, then take it under tap water. Your hospital is not in the road. No, you don't wash it and squeeze. You just dust, then dust under, wash under tap so that the water can push the dust away, and dust, then air dry, not sun dry. The reason that if you sun dry, it gets old quickly and it start breaking off. So just put it by the window. Just put it by the window. You will dry. As fragile as it is, you can use for 5 years if you don't put it inside the sun. if you don't put it inside the sun. So then after that, you keep back. Then all these, you are not meant to touch them. You are not meant to wash or anything. If there's dust, just get a damp stuff and clean them. That's all.
Did you offer free maintenance?
Yes, we do. We're supposed to offer like one-time maintenance for you for free. Yes. Yes. So it depends on your frequency of use. This place, I think, it will do just one time in a year maintenance. Because it's not a ghetto now. Maybe where you have dusty, ghetto rugged area now, we say okay, we come 2 times. But this is a clean environment. You don't need stuff like that. Organisms, everything will be filtered back, and it also has a filter inside again that trap bacteria. Those things happens inside. So what you get outside is 100% pure gas. Yes. Okay, no, you can disinfect. You can disinfect. It does not affect. It does not affect. It does not enter inside.
That's the source. So if it's going to observe long, that means maybe it's remaining.
No, if if you are maintaining, if you are cleaning, definitely the machine is not working when you are cleaning it. You are not using it when you are cleaning inside. Whenever you are cleaning inside or any electronic device, it's not advised to keep it on. It's when it's off that you clean it, and over time it will evaporate off. That's one. Then two, the machine has a lot of filters inside. This is one of them. This is one of them. That's why even if you spray perf, the perf will not enter and come outside here. So the first step is to put it on here. This is the on button. After you've plugged, of course, put it on button. You can see. So now we are going to fill this with water. This will help us to see. Okay. It does not require external. It does not require external oxygen. So let me explain the okay, let me explain the engineering behind that. Now, if you go to oxygen plants, factory, they have machines, big machines. So that same big machines you have, they have made them small inside this. Let's say, for instance, now your computer, your big computer like this, you have a RAM, CMOS battery, this and hard disk, everything. But the same way you have your good tab, they can still do the same thing that is doing, but they have converted or made those things companies smaller inside. The same thing with this oxygen. Yeah, it's an oxygen generator. It has it inside, and if you have oxygen analyzer, would have analyzed it from here. You would see it has everything inside. Though they build it like oxygen concentrator, oxygen concentrator, that's the same principle they work, but this one has a splitter inside. Split oxygen here, split air here. Our environment, we have oxygen, nitrogen, everything inside. So this will now bring everything in, take the oxygen O2 pure, put it one side, then the air that we breathe in normal that has 21% of oxygen, it put it here. But meanwhile, it removes unnecessary components in it, like gas that are we have dust, smoke everywhere, CO2. It disperse them out. Yes, it take them out. So we have the air compressor. What your air compressor can do for you, that big air compressor, it has this inside. It gives pure oxygen that does not have a toxic gas. Sorry, pure air that does not have a toxic gas in it. No dust. But the way we have, I think nitrogen is 20 or 70 something, oxygen is 20, we have it here. But any toxic element or gas will be removed, except the essential elements in our hair. I don't know if you understand. That will be left here. While on this side, only oxygen will be here. But we assure you with these six settings that whenever you see O2, it shows you that the oxygen coming here is pure.
There's an oxygen
Yes, inside connect. Yes.
so if it's not green, call you.
Yeah, if it's red, you call me. Or if it's yellow for forever, understand, then you can call me. But if it can turn yellow for 5 to 10 minutes, no problem. It will turn green later. But if it's red, then you can call me. That means this machine is not fit for use in terms of the gases. It can be due to electricity. You might not plug it, it will show red. The light might not be sufficient to show red. Then you can call me. Then we do that. But once it's yellow or green, means you are good to go. No, no charge. You have to connect the light. So this every CPAP is a closed system. That's one thing we have to know. If not, it will not work. Whenever you are covering, number one, you have to ensure that it's properly covered, and two, it's not too tight. Because if it's too tight today, tomorrow it's too tight, next tomorrow, one day you just tight and break. You just ensure that it's fit, no leakage, then you can use. From here, just put it down, then you screw. Ensure that it is straight, it's not hard. Whenever you are copying any medical equipment, it should not be hard. But you know that it's screwing. So you can see that it's bubbling. Bubbling means gases getting into this. Why this humidifier should bubble throughout the process of the CPAP therapy. In as much this machine is on, this guy should be bubbling. If it's not bubbling, you have to check oxygen is not coming out. Even if the machine can be on like this, but oxygen is not coming out. Let me demonstrate it for you. Can you see? Yes, I've off them now. You can see it's not coming out. So put it on, it's coming out. So next after this is we are connecting the water trap, because if as this thing is bubbling, there's tendency that some will splash, some will condense along the line. So this water trap, we trap it so that it doesn't get. Yes, something happened that time when I first started doing CPAP. So in the hospital they don't have CPAP, so we are using improvised, and that was when I connected the patient. Before I know, water went through inside the nostril of the baby. Why? Because there's no water trap. Then two, my our connection is bad. I didn't understand the principle much then. So and one of the things I did then was that the water was too much. That's why you shouldn't allow your water level above this. Once if the water is too much, it will go like you will see it, it will go through. So, so I don't know how. Yes. So just after putting it, just screw. Just screw. So these are the accessories for the water trap. If there's a way you can, if you want to wash it so that you can separate, you don't get confused easily. These three, that's why they separate everything here. This water trap will be connected to this, because after this I'm going to dismantle everything and keep, so that you know how to connect them back. So the water trap, like I said, will be connected to this to trap water. Water shouldn't get. Yes, we will, but definitely one day you want to wash, you want to couple, you want to take, so that you can do that yourself. So once I couple it, you can keep using it that way. Maybe you need to wash or change the water without going through all this from the beginning. So the first one side goes to this, the other one goes to this, and this goes here, then this goes here. So whenever you're assessing this, try to provide some support. Some will just carry it and just like this. So you can break this, you can break this, you can break anything. So from here. So we have your tubing. So this now. Sorry. There's one. Okay. Have you filled the bubble bottle? Okay. So next now is this bubble bottle. Just hang it here. will not fall. Steady. It won't fall. We have so this goes here. Then this other one is like a straight guy come here. You understand the settings. So from here now you now connect your TV. No, it's not have to be tight. Just put it. It's not force. You shouldn't use force in any of those things. Just ensure that it fits. It fits. Just leave it that way. There's one. One comes here. Like I said, there's no difference between the inspiratory and the expiratory. But wherever they go to, then after that, determine or define their name. These tubes now that went to this bubble bottle became the expiratory tube. Because sometimes you may have some challenges that I will tell you, sir. Okay, I didn't put it in. Because you might have some challenges, I will tell you, check, I might use the name. Check the expiratory. It's just because it's thin, that's why it's not fitting. So that's the thing. The one, the one that goes to the humidifier here is called the inspiratory. Because we have not still new, that's why it's looking like that. So from here now, we now connect the interface. Yeah, like this. So this is called the nasometer. Because for you to know the appropriate size of NASA prong for the child, you use this to size, just put it, the one that matches the hole of the nostrils, then you cannot tell the size here. You have size 0, 1 to 3 or small, extra small, medium and large. Once you put it, the one that covers it, then you see the number. Let's see this one, you use this hash 2, then you look for it. This is 0. Let me look for size 2. This is size 3. Yes, this is size 2. On the neck, it's very faint somehow. Can you see it? Size 2.
I didn't see.
This corner here. You can see this corner here. Size 2. So this, so let me explain. So this one that does not have anything like a cover of this your cannula here, you go to the inspiratory or is
One that's not divided into two.
yes,
Okay.
go to the inspiratory. So there's still one thing needed.
The extra.
No, this one is there's no extra. Okay, yeah, they're extra. I'm looking for one. No, not students here. So, Senate. So this will go inside because it's still on. That's why. Once you put it, you don't need to be removing them again. Please let me put this one while I'm doing this because they are still new. So but once you put it now, you don't need to put it again. Yeah, yes. So far it's fit. You cannot remove it. Okay. So this one that does not have like a curve, you put it on the inspiratory. Just insert. This one you put it on the expiratory. So from there now you can now select your NASA prompt. I think I will need to open one because it will help me to see explain some things.
You can keep it back.
Yes, you can. This size zero, this is least smallest. Yes. So and they are soft. You can see unlike our normal ram cannula. They are very soft.
This one that has I can't share
The,
has
nur- the nurses knows how to do it. Yes, yes, yes. You can buy extra. I think one you can buy extra. We sell essence. So one end goes here. So that end goes like this. So now connecting, doing the setup is one thing. Doing the setup is one thing. Then operating it is one thing. This is where the challenge and this is where the major of the work is. So let's start from there. What we set or what for to a patient, we set FiO2, we set flow rate, then we set bubble pressure, then the size of the NASA prompt. These are the four major things you should pay attention to. The size of the NASA prompt, the flow rate, the FiO2, and the pressure value. Of hair. This tell you that the air is on the 3, then the oxygen is on 2. Meanwhile, this can look more stable than this based on the way it's working inside, but that's not a big concern. You can see it's not very stable because it's here. Then 2 is on how to set the chart, the FiO2. So we have the vertical and the horizontal column. So the vertical column now is our airflow meter. The oxygen is this horizontal. Now, let's say there's a patient that require oxygen FiO2 of let's say 50. So you have to set your flow rate at a particular flow rate, oxygen to a particular flow rate, air to a particular flow rate to achieve 50. And to do that, just come behind here, look for the 50 you want to achieve. Say we have 50 here. So that means our air flow rate will be on 3. Oxygen flow rate will be on 2.
understand. What you are saying now is it I beg you explain what FiO2 means. Is it oxygen concentration?
Yes, fraction of inspired oxygen, the concentration of the oxygen.
Okay, oxygen fraction of
Inspired oxygen, yes, that's the concentration. Because you don't want to give 100%. You are trying to help the baby breathe at the same concentration as we at not normal, the 21% that we breathe with. So they cannot. So we want to help them to their lung to develop and any other complication they might have, so that they can breathe at that 21 FiO2 that we are used to. So we want to be calibrating it for them gradually to be able to breathe on 21. For yeah, for we are here now. The concentration of oxygen we are using is 21. Yes. Once it's 21, they can once they can be on our own ambient environment. So on let's say now if this case is a bit serious, maybe it's not even from the hospital, from somewhere, and the saturation of the baby is critically poor. So you can start from concentration of 95. Then after like 4, 5, 6 hours, you can bring it down to 70. You'll be bringing it gradually down. See, because you don't want to maintain that higher concentration for long. You can cause yes, exactly. So you can even go through this one. A lot of complication that it leads to. So we that's what we are trying to achieve. So let's say we have a baby, and whenever you are using CPAP, ensure the patient is on pulse oximetry. You are doing pulse oximetry time to time, so that you know that the patient that is not seeing 100% saturation, for especially for preterm, 100% saturation, and you keep doing that. At first, you might think, if you don't know, we think, he's doing well, 100 will be fine. But they've taught us that it's not good. Newborn or preterm should not be on more than 96 saturation, should not be more than 96. So what are we okay, let's say now if you are doing CPAP, you are giving oxygen, preterm is not good to be on 96 above. Preterm, premature, 96, their own target this is 92 to 96. Even some even say 90 safe. But we adults now we reach 98, 100, no bad. But to them, oxygen as it is, especially with flow rate while flowing, is not good for their brain and some other stuff like that. So it's good to maintain that. I'm not a neonatologist, so I learned to. Yes, sir. So that's it. So let me come again. We want to achieve 70% FiO2 for the newborn. So we look for 70 here. And so yes, two ways we can achieve. One is here, one is here. You can see one has more oxygen than air. But in whichever way, it's still the same concentration you are giving to them. No, one we have. Yes, you can get my concentration. Yes, and also sometimes you might need one with higher flow rate because of one, the depth of this underwater. Because if you are using flow rate and the depth is like 6 or 7, it might not bubble. You have to use the higher flow rate too, because the flow rate drives this bubble. The flow rate will drive this bubble. If the flow rate is poor, it will not bubble, or it will not bubble effectively. I don't know if you understand how the difference in flow rate comes in now. The first one is that higher flow rate helps to drive bubble more, and yeah, the pressure more. Then two, it also helps to drive out CO2 more if needed. Fine. CO2 more. But we should also be concerned not to give too much flow rate when it's not needed. So do we understand the concept of the blending and the flow rate? So it's simple. Please.
Let us know how this can also
Okay. Influence pressure. Okay.
flow rate.
No, the flow it's vice versa, but the flow rate influences it, has impact on it. The flow rate influence how well this will bubble, if it will bubble or not. So I shouldn't have used this size. I shouldn't have used this size. I shouldn't have used this size.
6 liters, then we use
Now, see, sorry, you say? Okay, yes. No, the reason why it's still bubbling is because of the size I use. It's very small. So let's see. The size is small. Let me try and reduce it. Now you can see the flow rate has dropped. The oxygen is still coming out, but it's not bubbling. So the higher the flow rate, the higher the bubble. The thing is off. I would have opened. No, as I touch the this thing. Yes.
the nurses. Nothing.
So, like I said, let me see, try if I can even remember what I said. The higher the flow rate, the higher the pressure, the bubble here. But the deeper the gauge inside, the higher the pressure. Okay, age, weight, they use weight, and the requirement. Sometimes the baby needs you need to recruit the lung like faster, and sometimes the baby is bigger, maybe like 1.5 kg or 2 kg. You might need higher this thing based on also the situation on ground. But if the baby is almost like 500 or 600, you don't use too much pressure so that you don't blow up the lungs or this thing. So you also, I think the pediatrician will determine that based on the condition of the baby. The most important thing is they know how they operate this. Now, what they normally do in where I used to work is the neonatologist will come and just write, give 6 centimeters of water with FiO2 of 70 for 5 hours, then reduce after 6 hours. So he has given us the prescription. So he said 6 centimeters of water, we put there is 6 centimeters of water, FiO2 of 70, we said the FiO2 is 70, and that's it. So the pediatrician or the neonatologist will tell us what he wants us to do because he has carried out his assessment test. Maybe he did blood gas, we don't know. He come and just tell us this what he wants. They will monitor. Our job is to set this and keep monitoring on the patient monitor or the pulse oximeter, whichever one we are using that day. So what else? What else do I need to talk about? Ma? First, the CPAP should be a closed system. If it's an open system, it will not work. And the first thing to know is not working, or the machine might be working, but your CPAP in terms of the treatment is not working, it's not doing its job. If it's not obeying the principle, that's the closed system principle. If it's not, but if there's a leakage in any of these routes, this, it won't bubble. This might bubble, you might be seeing oxygen at the end, but the way it works, CPAP is not a one-way thing. It goes here, come back, goes like this. So it can go like this but not come back if this guy is not bubbling. If this guy is not bubbling, it can be from here, that's where the fault is. If the nasal prong is not in the nostril of the baby, it will not bubble. If this is open, okay, what I've seen the doctor use, number one is extra secretion. There's one day also, I don't know which medicine he put. So it's just the point of removing and inserting. Like put syringe here, then it's maybe mope or something, it drags out. So you don't no most times you hardly use it. That cannula stuff. to cover it, but ensure that it's
Even if
locked.
this thing, I mean,
Yes, because by the time you're putting in their skin is fragile. It's like a foam, like a cushion. Because this is a bit harder than their skin. Pretend they are fragile. So by the time this thing preys for like 1 week, some stays 2 months, 3 months. So you now start seeing bruises. But with this, no bruises.
I see some babies they have CPAP mode.
Yeah, that's nose mask. That's another that's another interface.
It happens.
If you don't use the appropriate size. And another advantage of this one, this one is very, very soft. You can see it's very, very soft.
Yeah, the child is going back.
Ma? Ma? Okay, yes, I will demonstrate it. Give me your this. Let me use it to demonstrate it. So let's assume this is the head. Oh, sorry, I'm not done with this leakage of a thing. So these two you have to check and ensure that it's properly locked. Over time, if you see water here in this water trap, you just to turn, is it clockwise? Yeah, clockwise. Clockwise, anti-clockwise. You pour water, then you put it back. You turn. If you are using it on a patient, you cannot remove and go and disinfect. Highest you remove these two tubes, go and disinfect while you use these extra ones.
So like how many patients should I use this thing before I say I want to? Even if I don't see
At the
any
end of every
obvious
patient,
situation.
at the end of every patient, you disinfect. At the end of every patient, disinfect. And even while the patient is still there in the NIC or SCB, you disinfect your this normal is not very serious disinfection. Or there's a way they put Savlon and clean the incubator outside of the incubator and everything, or even while the patient is there. But once the patient is out, they now do thorough disinfection that they remove everything and clean am. So that, but at the end of every patient, you clean. Let's say at the end of every 24 hours, you change the water. Yes. At the end of 24 hours, you change this water, put new one.
We're not talking about
No, it's advised to change. That's it. During the day, while still using it, if it goes down, you can top up. But at the end of the day, you change just like in
so what if the baby is entirely on this CPAP
yes.
and is at the end of the day and we connect and we're talking about the baby is on this
Why if the baby is there, you don't need to disconnect to top. Just put it. But if I say you change the water after every 24 hours, it does not take up to 5 minutes to change the water. But if the condition is critical, you cannot remove. Just leave and top up. Yes, because of the child. Just leave and top up. The reason why they say they give us the guideline to change after 24 hours is that because they believe that as they are bringing everything, CO2 must have entered the water and then so that's why they say change with the fresh one. But if there are situations, let's say the baby is extremely preterm, you cannot take the child out of it at all. Just leave it, top up. It's because I'm asking question now, going back and forth. So this, let's assume this is the head of the child. Let me see. Explain another thing is positioning of the nasal prongs. If you can see that it's curved, it's not straight. So when inserting it, you take it like this, straight like this, and the nasal prong you are using ensure that it's at least 80% occlusion in the nursery, like it occlude the nursery. Yes, cover it so that it's the baby is almost breathing in back every not what it breathes like how like to say it. Everything is sealed. Let me use that term. Is yeah the circle. Unlike your oxygen, normal oxygen that baby has to breathe out from the side. This one no, let him breathe it back and come back from here to the nursery. So
oh man.
let's see. So this is the nasal prong now. Then let's assume this is the head of the child. This the child head is sorry is here. This is the head of the child. Then the mouth will be somewhere here. So let's assume this is the child. So you can see that the prong is facing down like this. You can see facing down like this.
Okay, so the child is facing us now.
Yes,
No,
let's
no, no.
assume this is me.
Okay, the child is facing that side.
No, it's like this. This is the child now facing like this now. So this nasal prong now will now come like this. Do you understand? This is the forehead of the child. This is the mouth. Then this is the nose. Then this will just be on like a cushion. Of course, the baby will be wearing a cap, a bonnet.
Where is the car?
Every, but their mother will bring cap for them once they give birth to them.
The baby car.
Yes, sir.
I can keep this for the
First
child
child.
that does not have car.
Yes.
It is a very tight cap.
Side, pretend my is very small.
It's true.
But normally their parents can still bring cap with them for
They
them.
not bring pretend cap. Nobody's expecting.
No, even if they bring a baby, it will still they bring fitting
They
cap.
have caps, other caps, different colors.
No, it's just white. So once it's there like this, then this strap. So this cap is just normal strap. Just take it through like this.
From the back.
Yes, whichever. I'm sorry. Just like, because it's not a baby, so it's not convenient for me to do. Just like this to hold it firm in place. Because some baby are very stubborn. They will do like this. They want to
It
remove
will go
it.
over the cap.
Yes, it will be over the cap.
No, it's not too tight. This cap is always tight.
No, it depends on this. Normal, if it, some hospital have caps in their so, but some hospital their parents will bring cap to them. If some pretend this cap is not small, it's even big. Safe. Some will be here and there. Some are small and some are big. Before it used to come in different sizes, but they branded it. They didn't bring. They only bring one size now. But like that value now, you see like five different sizes. Value, yes, has like five
How
caps.
far does it last?
Yes, it lasts, but you need to buy oxygen, but does not use electricity. Does not require only
More than
oxygen.
oxygen. Plenty
It
oxygen.
does not use plenty oxygen compared to other CPAPs. Yes,
Does it work well?
it worked well. Only that it has some. It's meant for low resource settings. Be- It's meant for low resource settings that cannot have. Let's say that cannot afford. Okay, let's say for instance, this one now warms the air. Value does not warm the air. You don't do anything. If you are using, if you I can put warm a towel and wrap it around it, or you can put inside your incubator. You just have to improvise and look for a way that is warm. So it's meant for low resource settings.
One is thinking, now have two babies that need.
Yes, like if baby is in incubator, it's easier. It can be warm easily. The tube because the tube will be in the
So the
incubators.
value enter inside the
If some mosquito put it, some just it's small. It's not big. It's not. It's just here. It's just like two bottles put together. If you don't want to put it, even if the tube pass through, it's still doing the job of the warming. And you can put it. There's a corner in your incubator that has it. On your radiant tumor, there's a corner that has hook where it should be on your everything. So this is just let me show you the simple every settings about the medical CPAP. This one, no, for some sockets cannot use that type, so we can connect it for you. It has yes. Okay, but Diamedica still has a okay. There is this okay. I know of that, but this one is a little bit better compared to other CPAPs. Now, if you are watching or if you are handling it, You have a how will I call it, a way of doing your thing. Now if one set of person is doing the maintenance is better for your part to last. When in my the hospital where I worked in Lagos, I was the one handling it because the nurses, you can say I was not the one on shift. I was this one on shift. They have like five of it. I told the madam, don't worry, I'll be doing the cleaning and everything. So I have a container where everything, I separated them inside the container. So they need CPAP. I label them CPAP A, this is the container, you don't miss. So I'm just the one in charge of the CPAP. So if you have maybe one or two person in charge of washing and cleaning, there's guarantee that it will be safe. And anything, no matter how small the thing is, the person might not be a nurse. No matter whatever you see on the body, don't throw it away. Keep it, no matter how. A cleaner can come now and say, I wish rubber with it, just kick it away. You can even see this small one, just kick it. But tell them that no matter whatever you see on it, keep it, wash it and keep it. So with that, it will be safe. And if you are washing too, don't dismantle too much. Don't break everything too much into pieces. Like this one now, just remove only this, and only this. There's no point scattering everything again. By doing that, you might still get mixed. So as you remove, okay, the if depends on what you use here. You can use, let's say, 30% or 20% of Savlon against 70% of water that you mix. Then that's the concentration. Then you soak for like 50, let's say 30 minutes, 30 to 40 minutes you soak. Then you wash or you rinse under tap. You don't use ash detergent. Normal yes, clean tap water. If you're clean hot, then you rinse, then you air dry. Don't dry under the sun. If you dry under the sun, this thing will get weak easily. They are plastic, they break easily. Then two, dry it under the sun, particles will enter, germs will enter. So you better just have a small hanger in your NICU or somewhere good. Just air dry it, then let it drip off. So I think that's the thing. And another thing also have to take note of this dial. Sometimes if you in the quest to want to give the patient all the this thing, you might increase it like this. And before you know, PM, it will turn red. So you have to reduce, ensure it's on the good part. I think basically that's everything about Diamedica. Ensure that it's properly closed, properly locked every time any day you are using it. So that's everything about it. If there's any question of concern, no, I want to put this back. I said if there's any question that I've not answered, some prompts should be on the ground here. Yes. This is still this one, extra of this. No, no, that one is still sealed. I'm packing this one back. I've not even used that one since. I've not used it before. I don't know. I don't know what that one is for. I've not used it before, and that's what I'm saying. Now that I've not used it before.
You check the number and tell them.
Okay.
I think I tried one day. Okay, how to do the about? Can you not be connected to this man? Or CPAP only?
Yeah,
I don't CPAP have
there's some depends on the design of the. No, no, the NASA mask is different. The face mask, CPAP face mask is different. Sorry. Okay, thank you. Sorry, thank you. Just so beating did not break. Thank you, thank you. Yes, they were. Thank you very much for joining. So you can send the sir. Thank you, sir. I just hope it's
very much.
yes.
Appreciate it. Everyone. That's what it's for me. Just do it. You have to get that value.
Value.
Yes, twins now. Go to penny CPAP.
Yeah.
Let's delegate one.
Going on this yes. So Values does everything to blend. The only difference is that it does not warm. Then two, it does not generate its own oxygen and but yes.